You recently put out an 11-point plan to rescue America. All federal legislation sunsets in 5 years and potentially sunset programs like Medicare, Medicaid, and Social Security.
Well, John, that's, of course, the Democrat talking point. It's a
No, it's in the plan. It's in the plan.
But here's let's think about reality for a second. First of all, let's talk about Medicare.
But Senator, hang on.
John.
So it's not a Democratic talking point. It's in the plan.
The biggest problem facing America today is income and wealth inequality. Since the so-called Reagan Revolution of the 1980s, the top 1% of earners have seen their share of income grow by more than 150%, while the bottom 50% of earners has seen their share of income cut in half. This multi-decade wealth distribution to the top means many middle-income workers in America today can't afford to feed their families without welfare and need to do everything they can just to not end up sleeping on the streets. It's a grim predicament for anyone born without a significant inheritance of family money. Now, imagine income inequality gets exponentially worse. But this time, the decline doesn't happen over a period of 4 decades, but instead over the next few years. That is exactly what will happen if Republicans achieve their goal of cutting Social Security and Medicare. Homelessness will increase as Americans too old to work or legally disabled are no longer able to pay rent. Some of them will move in with their adult children who now have the responsibility of paying for care of their vulnerable parents while barely being able to pay for their own family. Remember the family from Charlie and the Chocolate Factory? That was the best case scenario for old and disabled people before Social Security. Healthcare premiums for our nation's sickest population will skyrocket in price as Medicare no longer covers hospital care and inpatient care, and more people will have to die in their homes, often alone, because hospice care has become unaffordable. These are all things currently covered by the basic federal programs of Social Security and Medicare. I'm talking about OASDI, or Old Age, Survivors, and Disability Insurance for Social Security, and Medicare Part A, which covers inpatient care in a hospital, nursing facility care, hospice care, and limited home health care. While the terms Social Security and Medicare extend to several different state and federal programs, these programs are the most critical. They provide the most benefits, they provide for a basic standard of living, and they are under the most threat from the Republican Party. If there's one thing that made America America, it is this. In the decades after the Great Depression, the U.S. government put in place progressive tax and regulation policy that curtailed open market capitalism, dramatically decreased income inequality, and therefore allowed for the creation of a prosperous, thriving middle class. Two of the components that enabled the American middle class to thrive are Social Security and Medicare.
This Social Security measure gives at least some protection.
Since the Reagan Revolution of the 1980s, Republicans have been systematically reversing policy that created the middle class, and income inequality and government debt has skyrocketed ever since. But Social Security and Medicare have survived mostly untouched. Why? Because the voting public, Democrats and Republicans alike, love these programs. Not because it makes them rich, which it doesn't. These programs simply give working Americans the ability to live with dignity when they are no longer able to work. And the people that receive these benefits are workers who have paid into the program for decades, along with their employer, through a payroll tax. The money goes into 2 different trust funds, and the money is lightly invested in the world's safest securities, U.S. Treasury bonds. Contrary to Republican misinformation, these programs don't contribute a penny to the national debt. The results of these entitlement programs are astounding. Adults age 65 plus used to be the most impoverished segment of American society, with more than 35% living below the poverty line in 1959. By 1979, the percent of elderly living in poverty decreased to 15% and continued to decrease to 9.2% by 2017. The percentage of elderly Americans covered by health insurance was only 31% in 1953. After Medicare passes in 1965, the percent of 65-plus Americans covered by health insurance increased to 97% by 1970. So, what would happen if benefits were cut or eliminated altogether? The University of Chicago released a study that shows that 66% of elderly Social Security recipients would be living in poverty without their Social Security benefits. And that's assuming that they would be able to keep their Medicare benefits. Without Medicare, we are now talking about tens of millions of seniors who have worked all their life, not only living in poverty, but unable to even afford medical care. The lucky ones would have sons or daughters who could try to share some of that burden, but most would end up living on the streets, dying at an early age. If these programs were cut or gutted, the American middle class would cease to exist, as every extra penny workers earn would have to go to caring for an elderly parent or saving for the day when they can no longer work. Forget buying a house or taking vacations. The struggle of today's poor would become the struggle of every middle-class worker and anyone without a large family inheritance. Everyone would be just one life event away from total economic ruin.